Welcome back. In this section, we're just going to look at a few blood vessels which bring blood to the outside of the skull. So we got to start in the neck and then we're going to work our way to the head. So let's do the arterial blood flow first, like we always do. Remember, we always start closer to the heart and then we're going to move away. And on the venous side, we start distal and then move back towards the heart. So at this point, we already have our common carotid artery and has bifurcated to a posterior internal carotid artery and then the more anterior external carotid artery. And off the external carotid artery are all the blood vessels which are going to be going to the head. And so we're going to learn just a couple of those. The first one branches off and crosses the mandible at some point. So you're just looking at anything in that general area, and from the mandible, it's going to move its way anteriorly and go to the face. So this is called the facial artery. And then the other artery we're going to learn about is actually the very last part of the facial artery of the external carotid artery. After any branches come off of that wants to branch, what is left up here in your temple and that you can often see pulsating is the superficial temporal artery. And so be very careful with your wordage. People often say, oh, I can see the pulsating vein. No, it's the artery that's pulsating. But if you see the blue structure that's not pulsating, yes, then that is the vein. So this is the superficial temporal artery, and that and the facial artery were all you needed to learn. So just to review, we started with the common carotid artery. We had the internal carotid artery, which went inside the skull and eventually will give blood to the circle of Willis. And then we had the external carotid artery, which continued externally. The main blood vessel that was going to the face, somewhere near the angle of the jaw, is known as the facial artery on this one, and you clearly can see other branches that we are not talking about. And then we have the remnant, the very last distal part, the most superior part of the external carotid artery is the superficial temporal artery. So for venous blood flow, let's pick up where we left off, and that is right next to the superficial temporal artery. You're going to have what else? A superficial temporal vein, and it will drain blood inferiorly, and that blood will be joined by blood coming from the facial vein, which, as you can clearly see in this model, is right next to the facial artery. Now, the blood will then, what's very interesting is the blood from those two blood vessels actually drains into the internal jugular vein. Mind blown. I think you clearly can see those draining into this structure, which is the internal jugular vein. Only the posterior aspect of the skull will drain into what is known as the external jugular vein. And the reason for that is these two jugular veins do not fuse into a common jugular vein. They stay separate. And so the internal jugular vein is coming from here and the external is from there. And so the internal is actually the one that's going to be closer to the facial vein, a superficial temporal vein. That's why they go to where they go. Otherwise, they would have to bypass that really good vein and go posteriorly, which they're just not. So, pointing out once again, the external jugular vein is going to be the more lateral. Why? Because it is lateral in the head, therefore it's going to be lateral in the shoulder. And then the internal jugular vein will also drain its blood, including the blood from the superficial temporal and facial veins. And both of those will drain into the subclavian vein. And with that, we are done with blood flow to and from the head. And I'll see you as we continue our exploration of blood vessels.